Hi, so today I wanted to make a video on osteoarthritis. I chose this topic because it affects my mom, and I want to make this video to raise awareness of how you can help anybody that you know that has osteoarthritis and just generally inform people about the disease, and I'll explain what it is. So arthritis in general is an inflammation of the joint. Basically, if you've ever worked out before and you say you hit arms one day, your joints and your elbows are probably gonna hurt. If you did triceps, your elbows are really gonna hurt. It's basically just really it's what you are getting with soreness, but like times 10 because it's a degenerative disease. So osteoarthritis is more specific in the form that it is associated with the breaking down of joints and cartilage, and is the most common type of arthritis. It usually affects weight-bearing joints such as the knee, spine, and hips. So the elbow is just an example of like arthritis in general. But for osteoarthritis, it's more weight-bearing joints. I know for my mom, it affects her knees the most. She actually needs surgery because of it. And her feet and her back hurt a lot. It affects over 27 million Americans, and the risk of obtaining the illness increases with age. It is also hereditary, so I am actually at risk for this disease. Most symptoms develop gradually over time. Joint soreness, like I said, aching, pain after overuse and long periods of inactivity, stiffness after rest, and joint swelling. So it's kind of like a double-edged sword, which a lot of people don't recognize, that there's really no way around this besides medication and some therapy. You can't lay down to rest your joints because that'll hurt them, and you can't go out and work out because that'll hurt the joints. Like, you can't overuse them, but you can't underwork them, and it's really hard to find that median for a lot of people, including my mother. The joints can get swollen, warm, and oftentimes make cracking noises, and I'll get to how I help my mom with that in a second. Where there's no cartilage left in some severe cases, like my mother's, there's bone-on-bone contact, which can limit the person's motion. My mom is bone-on-bone in both of her knees, which is why she needs a double knee replacement right now. Symptoms can vary from patient to patient, as well as be intermittent, actually. You can go a couple of years without even feeling any symptoms. But the way you're able to diagnose it is with x-rays and to see where that cartilage is on the x-rays. There's no definitive causes. It can be hereditary, be because of obesity, age, joint overuse. If you're an athlete, you can easily develop this disease, or an injury, because when you get an injury, other parts of your body are more, you're more dependent on those other parts of your body, and those joints can be affected. So for treatment and medication, it's very long and it's extensive and uses a combination of treatments, actually. Obviously, if the patient's overweight, they should try to lose weight first to try to take some of that pressure off their weight-bearing joints. Physical therapy is what my mom does a lot, along with medication, and I'll get to that in a second. Muscle strengthening and exercises, applying hot and cold pressure, removal of joint fluid, injection, medication to the joint. My mom does injections into her feet and knees, and sometimes she says they help, but sometimes it actually hurts her more for some reason. Crutches, a cane. My mom uses a cane. She doesn't use Advil or Tylenol unless she can't take the medication that is more, it's like a higher dose of Advil, because maybe it can conflict with another medication. So when I interviewed my mom, I learned a lot, even more than I did researching it, and that it actually hurts her a lot more than I thought, and that I thought that she was just like giving up and not trying just because she was sore, but it's much more than that. She said on a scale of 1 to 10, it was an 8 for her. Some of the medications she takes are, well, like, this is the treatment plan for her. There's some nerve blockers. She says that sometimes she just doesn't take her medication because it conflicts with other stuff. She takes non-steroidal anti-inflammatory drugs. but she has a lot of heart problems as well, so she tries to stay away from medicine, and she does more physical therapy. And she actually likes physical therapy because she can talk to people that empathize with her and her pain, and they can try to get through it together. But now on to how I help her. Also, when I interviewed her, I realized that there's a lot of limitations she has in her life. She loves to dance. She danced all the time growing up, and she can't do that anymore, which is really sad. And she can barely walk now. And so how I thought of helping her was the most valuable thing for her is her legs. And it hurts her a lot to go and get things and just change the air, get an apple, get food and water. We have a big house, so walking across the house is very hard for her to do. And so there's an app on the phone, basically just a walkie-talkie. And so she can just tap it, and I'd receive it, obviously, and contact me anytime that she needs something, and then I'll be there for her. And has become very helpful. It can be annoying, but I know that she needs it. If she needs food or water, her clothes, change the air, bring her something from her purse or anything, she can just instantly contact me. Another thing that I did was she has a cane, but it's just a regular cane that's straight, and I got this thing you can put at the bottom of the cane for more stabilization for her, which just helps her walk better and more effectively. Lots of times I'll just text her and see if she needs any ice or heating pads, and I'll prepare those for her. Like the heating pad, I just put in the microwave. Sounds funny, but it's like this big pillow, and I put it in the microwave, and then I bring it to her, and she says that helps a lot with her joint pain. But other than that, I get the groceries out of her car. Any heavy lifting or walking just to get pressure off of her feet, and she lays down a lot, which I don't blame her. She's in a lot of pain. I just do for her. But I hope this raises more awareness about osteoarthritis, and that you help and educate people around you. Thank you.